Hi, my name is Lisa. I am a 52-year-old esthetician. I have worked for a dermatologist in the past, and I just wanted to give you sort of a rundown on some of the products that are out there. And certainly, if I can be of service and answer some of your questions regarding skincare, feel free to put those down in the comments, like and subscribe if this is of value to you. So, what I did do in the first video was just to give you sort of a rundown of some of the things that I will be covering in this short video, simply because I don't have a lot of time today, but also I wanted to do a follow-up on the product of Riversol. Riversol is actually a product that came from Vancouver, Canada, and it is a 15-day trial sample kit. There's no charge to you when you do order it. It is by a dermatologist, Dr. Jason Rivers, that created this, and I just want to say that this was an excellent product. So first out, there are several aspects to it. I mean, you're starting out with a cleanser, and then there's, of course, the anti-aging reparative syndrome, the moisturizing concentrate, and then there's a glycolic peel and a hydrating cream cleanser. I did feel that given that I live in Canada and certainly where I am currently at, it is winter here, so I find that there's a lot more of a drying effect. So I am looking for moisturizers that have more of a long-term effect on my skin during the day, simply because I don't have the time to keep to frequently reapply moisturizers in around the eye area and so forth. So I did find that this moisturizer, the moisturizing concentrate, was specifically my favorite. It is thick enough and yet thin enough. I'm not really crazy about a lot of lotions because my skin, as I say, is fair skin, so it does mean that I have more of a propensity toward dehydration and damage, and certainly sun damage and cancers. All of those things just sort of exponentially increase with fair skin. If you do have a darker complexion, olive skin, and so on, you've got melanin and so on to help protect your skin from sun damage to a degree. I mean, if you're out there every day, there's still going to be a cumulative effect, but overall, I did feel that this particular product really did some had some very beneficial effects on my skin. I did notice that people were mentioning my skin more, which is not really a common thing for people to bring up, but that there was some level of improvement. And again, I've kind of been out of it for the last week, so I mean, if I've gone downhill over the last week, I mean, be aware that this is moving just slightly past that 15-day mark. But I did really like the hydrating cream cleanser and the anti-aging reparative syndrome or serum, serum. I also found to be quite good. It's got the consistency of somewhere between a lotion and a cream. It's easy to apply. These are for sensitive skin specifically, so if you're somebody who is overreactive, I mean, very ideal product. The hydrating cream cleanser, again, was quite nice, but a little more on the lotion level for me. I didn't find it was as hydrating as I needed, but the moisturizing concentrate, again, really can't say enough about that one. I also found that there was also the exfoliating glycolic peel. Okay, in all fairness, I did forget to take that one. It kind of got mixed up in my group here, so next week I'll be able to throw that one in there as well. But anything that deals with exfoliation certainly does help the skin to look brighter. It does get rid of the dead skin cells. Anything that helps to dull the complexion, certainly a lot of, and that would just add to lines and anybody who is moving into mature skin would certainly need to be doing exfoliating. And not to say that a younger person shouldn't do exfoliation as well, because certainly with oilier skin, I mean, there's a lot more accumulation of dead skin cells that sit on there in the oils. So really, any kind of exfoliation product is always ideal. So again, I did oversee that one. I will have to add that into the next video. But as far as the rest of it, the anti-aging reparative serum, as I said, is ideal. I did feel that it was, again, consistency was easy enough to apply. A little more on the lotiony side for me, but again, it's more of a concentrate. So I'm going to do a little more research on what goes into the ingredients of these products for the next video to break it down to see why exactly they were so effective on the surface level for me. But again, this is a product that is 15 days. They give you sort of a rundown of how to use the product from day 1 through 5, 6 to 10, and then 11 through 15. And then you're using the peel usually after day 11, and that, of course, is where I neglected. I had them all sort of I took them out of their packages, so it wasn't organized in the way that it should have been there. But anyway, once you do the prep of the cleanser, which is great because the cleanser works very well on people that have really sensitive eyes. And of course I wear contacts, clear contacts, but nonetheless they are contacts that any kind of product around the eye area can irritate very easily when you wear contacts, because it rubs up against the the surface of the eye and the interior areas, where your lash line is, all of that. And when I have had reactions in the past, I found that I did get like little tiny cysts underneath the eye itself, which caused some real discomfort. It makes you feel as though the eye is grainy and that there's something that you sand in the eye, like you always want to be wiping it. And of course, when you wear makeup and that kind of thing, there's a lot of issues around that. So I do wear waterproof makeup, so this was ideal for removing that. I have used oils or variations of oils that were specifically designed for waterproof makeup too, that were supposed to be hypoallergenic, but I still had reactions to those. I did not have a reaction at all with this one. It does remove eye makeup very well. As well, I do find that the product, as I said, I know that it has some kind of an antioxidant properties to it, and there's some sunscreen involved there, which is perfect. Again, ideal for someone who has quite fair skin. Actually, anybody in general should be wearing sunscreen, especially with the environment as it is. Whether you're in a very hot climate or you're a very cold climate, there's a lot more external damages to any of those extremes. It's hard to find just the right temperature. But outside of that, as I said, I can say nothing bad about this product. I found that it was ideal consistency. I did have more of a preference to the moisturizing concentrate. And again, that was because of the consistency is a little thicker for someone like myself that has mature skin. It's a little bit drier, and certainly it's not a really heavy product, but it's not so thin, as I'm not super fond of lotions on my particular type of skin. Lotions may be more ideal for a younger skin, but I also use Retin-A, so that also, in some ways can create a little more of a dryness as well. But I have used Retin-A for years, so that's not something I have to learn to tolerate. My skin has already built a certain tolerance to it. And again, I do use other products, sort of following that are Retin-A, vitamin A based, and again that also is known as Steve A, tretinoin, and those are variations of those are sold over the counter, but again they cannot go beyond a certain grade, so it's really a minute amount of that product. I actually do get the product that is by prescription, and that one is again, it comes in gel forms, which you would not want to be using on your skin unless you're very acne prone. But it also does come in the cream forms, which is what I use. And again, that's just so it's a safer way of tolerating the cream. And there's different, levels of it, 0.01, 0.05, 0.1, that kind of thing. It goes up in grades, but usually doctors are less inclined to give you any higher levels of Retin-A. And certainly, when you do use Retin-A, I mean, going around the eye area is not really, it's a little ill-advised, so better to just stay in the areas where T-zone. And when you do put on moisturizers, most people make the mistake that you're putting on a moisturizer close to the eye, but as you blink, everything goes up into the eye area. So when you're getting a burning sensation or your eyes are always watering, there's a good chance that you're getting a reaction to over product. So when you do put on moisturizers, make sure that it goes down into these areas here versus higher up. And again, it's always good to do masks and those kinds of things in some of the winter months just to combat some of the drying effects. But as I say, just as a quick synopsis video here on Riversol, I had very positive experience, and I hope that you will take that into consideration and trial the product as well. There is a 1-800 number here that they do give you as well. I did this one online. That's how I picked it up. I'm just looking for that 1-800 number for you to follow up with. But again, it's Dr. Jason Rivers that created this. So I know I saw a number on here, but of course, there we are. It is a 1-866-774-8377. And you can also, if you have questions or you have you'd like to order it online as well, you can go to info@riversol.com. Riversol is spelled Riversol.com. So info@riversol.com, or you can call the phone number of 1-866-774-8377. So again, can't say enough about this product. Riversol is excellent, and I encourage anybody to give that a try. And again, I would say this is really for all age groups, but as I said, you may find that may have more of a preference over another, and you just gauge it according to that. So I prefer the heavier creams versus lotions, but again, if you have a younger skin type and you feel more comfortable with, just some of the serums or the concentrates, those are usually not necessarily used during the day. They're more for a night treatment, because you have to remember, when you go outside, a lot of these products evaporate, especially Evian water and things like that, where there is, any kind of water that you apply to your skin will evaporate. It needs to have some kind of a barrier to trap in the moisture. And that I will go through on the next video that relates around hyaluronic acid and how that actually works. Some of these products have anti-aging effects, but it doesn't mean it's a long-term effect. You would have to continually use the product to be able to continue the benefits. So anyway, that's just a quick synopsis. And if you have any questions, please like, subscribe, enter your comments down below, and I will be back for video 3 in the coming weeks.